we've got a number of projects which are ongoing, mostly revolving around the hospital-based patients. So almost anybody who comes into hospital with COVID-19 will get asked if they'd like to participate in one of the observational studies that we're doing. And the aim of these is to find out in the long term what happens to patients who've acquired COVID-19. A lot of people will also be asked if they want to participate in one of the treatment trials that we're doing. So as part of a national effort, we're recruiting patients into large clinical studies to see if we can find effective treatments for those with more severe disease.
And what's the response been so far? Of quite a number of patients taken that up?
Yeah, so overall, we've had over 700 people who participated in one or other studies, and over 100 of those are actually in the treatment studies that we're starting. So the main one of those is a study called Recovery, which is a national study, has recruited over 5,000 people over the whole of the country so far. And this is it's an interesting study, actually, because it's got a trial design which is called adaptive. That means that you can introduce new treatments as they become available, rather than being stuck with the design which was set up right at the very beginning. And so, in fact, I heard as of this morning that we're just about to introduce a new arm into that with a new treatment, which hopefully might prove effective in this disease.
I know the centre's put in a large amount, if not all of its resources into tackling COVID-19, but even so, the turnaround of these results, how quickly you're getting answers on what's working and what isn't working, is quite remarkable, isn't it?
Well, I think this is about treating severe disease. So I think there are a couple of things just to remember here. So the first is that unfortunately, some people do get severe disease and people die of that, as we're all well aware. But the vast majority of people will get very mild disease. And these treatments we're talking about are really aiming at those people with severe disease. So the other challenge is to try and deal with the virus out in the community. And that's going to be a longer term job, I think. So obviously, the best hope is to come up with a vaccine, but it's not very easy to make vaccines against this sort of virus. And whilst I think studies are due to start fairly shortly, and hopefully in Nottingham will be able to participate in those as well, the best guesses are that if we get a vaccine which works within less than a year, we'll be doing extremely well.